how to help your clients with pain in the sacrum, where they come and they tell you, oh, I've got this pain right in the center of the lowest part of my low back, and I just can't get out of that pain. It hurts when I stand. It hurts when I stand too long. It hurts when I walk, when I run, when I go up and down stairs, right there in the center. I'm going to tell you where that's coming from and what you need to do to help them to get out of pain coming up next. Okay, FreeBody Massage family, Kat Matlock here at FreeBody. And this is a pain that people will say, sometimes they'll just be like, oh, it feels like I fell right on my sacrum. It's this deep ache. Sometimes it's fine, sometimes it's terrible. Sometimes it's worse when I sleep. I can't sleep at night. I'm tossing side to side. Neither side is comfortable. They'll tell you that they have pain when they stand for long periods of time. So what's going on here? This pain specifically is coming from a muscle called the gluteus medius. Gluteus medius is one of the muscles that I call the rotator cuff of the hip. Now, you can't just work around the sacrum or even just release the gluteus medius and expect them to feel better, because, as I always say, often the muscle that's crying out in pain is the end of the tensional line and not the beginning. If someone comes to you with back pain and you're just working on their back, they're probably not going to get better. If somebody's coming to you with neck pain and you're just working on their neck, they're not going to get better. If someone's coming to you with the sacral pain, and even if you know it's coming from glute med and you're just working on the glute med, they are not going to get better. Why? Because often the muscle that's crying out in pain or that is dysfunctional is the end of the tensional line and not the beginning. In this case, the gluteus medius muscle is the one that's crying out in pain. You can see here in this picture, it causes that pain right at the sacrum, at that deepest, lowest point in the low back, right in the middle of the very top of the buttocks. Now, this pain is usually relative to one hip being higher than the other, and I did a little video and a treatment about how to take care of that. And you're going to want to watch that video as well. We'll put a link in the description to that video, because I show you how one client has one hip high, and then I work on the inner thighs, I work on the opposite outer hip, and then I work on that glute med. That's the order you want to do things. You want to get your client side lying on the affected side, and you can tell them, this might exacerbate things for a minute. It might be uncomfortable for you to lay on this side. I get that. I promise this will help. We just need to release some things first before we can work on that glute med. I want you to keep in mind that glute med carries its trigger points along the belt line, kind of along the top rim of the pelvis. And when you are working that, you have to kind of check all of those areas. But where you want to begin is the other side glute med, because that one might be kind of pulling down, effectively pushing up the other side. And now that affected side is like, that glute med is freaking out. It's hanging on for dear life, and it's loaded with trigger points. So what you need to do first, get them side lying, work on the outer hip of the opposite side, glute min, do a little glute med work on the opposite side. Now, while you've got them side lying, you can do inner thigh work, the adductor inner thigh work on the same side or the affected side. So we're going to say right side is affected side right now. And we know that because the pain is right in the middle in the sacrum. Maybe you might ask them, do you also get a little ache in the butt on one side? That's going to be the affected side. So you're going to work in that inner thigh on this side, because you have to release the muscles that are pulling on the glute med, right? So look at this picture of the glute med pain referral. Again, you can see that ache right in the sacrum. You can see that there's also maybe some SI joint dysfunction on a side. You can see there might also be a deep ache in the buttock. Notice that the trigger points there are right along that top rim of the pelvis. You got to get those points real specifically to actually help your client to get better. Okay, key takeaways. Sacral pain comes from gluteus medius, and it's often the end of the tensional line, not the beginning. So you can't just treat that gluteus medius and be like, I helped them, we're all done, right? You want to start with them side lying, link to a video of this treatment in the description. Work on the outer hip of the opposite side first. Then work the inner thigh of the affected side second. Then you can treat the gluteus medius on the affected side, and they're going to feel so much better. They're going to get off your table, they're going to stand up, and they're going to go, oh yeah, that is amazing. That works beautifully. Now, sometimes trigger points are really persistent. They like to come back, especially if your person is crossing their legs all the time. You want to let them know crossing their legs or standing with their weight on one side is affecting their pelvis and is pulling on those glute med muscles. So it's helpful if you do some counseling on posture. Hey, you can't be crossing your legs all the time and expect your hips to feel well. Or, hey, you can't expect to stand on one leg all the time and expect to feel well. When I had my chronic sciatica, I was always standing on the right side and I was always crossing my right leg over the left, which pushed this right hip up and led to my sciatica symptoms. It's the same kind of postural issues, different symptomology comes out with different people, okay? So all of that is to say that yes, you can help your clients with sacral pain. You just have to do things, as always, in the right order. So I trust that you found this video to be helpful. You can see that I have an online continuing education course that is all about releasing the glutes. And if you're in Asheville, North Carolina, come see me because I offer this class once or twice a year live in person where we get hands-on and I can really guide you in how to do that trigger point release specifically. Second best scenario, grab the online class, so helpful. And I go deep dive into the anatomy, into the trigger point location, and then very clear guidance on how to do the release. So I'm Kat Matlock here at FreeBody Massage. Thank you for watching. I'll see you in the next video.